Hi, my name is Sarah, and I'm a cardiac imaging nurse navigator for Cone Health. If you're watching this video, you've most likely been prescribed a cardiac CT by your cardiologist. I'm here to help you to prepare for your cardiac CT appointment. I hope that after watching this video, you are well prepared for your test, which will help to produce a higher quality study, and you'll know what to expect during your cardiac CT appointment. A cardiac CT is a CT scan that uses radiation and contrast to highlight the vessels and structures of the heart. This gives us information about your heart's anatomy to help guide your cardiologist in your medical management or upcoming cardiac procedures. To prepare for your study, you may be asked to obtain blood work and pick up medications. Blood work should be done no sooner than 3 weeks prior to your appointment and no later than 24 hours prior to your appointment. Prescriptions should be picked up no later than 24 hours prior to your appointment. On the day before your test, please drink lots of water and avoid caffeinated beverages or stimulant medications for 12 hours prior to the test to keep the heart rate slow and steady. This also includes decaffeinated teas and coffees, chocolate, and antihistamine-type medications. On the day of the test, you'll take any medication prescribed to help lower your heart rate 2 hours prior to the test. The most common names of these medications are metoprolol and Corlinor. You can take any other daily medications with the exception of your diuretics. You'll be allowed to eat and drink until 1 hour prior to the test, keeping in mind to also avoid caffeine and chocolate. When considering clothing options, please avoid metal items to the chest. This would include the underwire style bra, hook and eyes are okay, metal snap buttons, metal zippers, jewels, or sequins to the shirt. We will need access to your chest for cardiac monitoring, therefore we also ask that you avoid dresses or other one-piece outfits. We will see you 30 minutes prior to your appointment at your respective site. When you arrive to your appointment, you will check in at the radiology registration desk. Shortly after, a nurse will greet you and escort you to the radiology department. Here, you will get a set of vital signs and an IV placed in your arm. You will be provided an opportunity to use the restroom and change clothes if needed. Once we have determined you are ready for your scan, we will escort you to the scanner via wheelchair, as to not increase your heart rate. We will assist you onto the exam table. A heart monitor will be placed on your chest and the contrast line will be attached to your IV site. Depending on the nature of your cardiac CT study, we may give you nitroglycerin. This is a tablet that will go underneath your tongue and will dissolve. It helps to dilate the arteries to maximize blood flow to the heart, which also ensures the images we obtain are as accurate as possible. For this reason, you will need to hold medications used for erectile dysfunction, such as Viagra or Cialis, for 72 hours prior to your test. We will position your arms over your head and you will be asked several times to hold your breath for a few seconds. This makes sure there is as little movement as possible to get the most accurate results. You'll get a warm sensation during the contrast administration, but we will let you know before this occurs. This should not hurt and will pass quickly. Your scan will be completed after this. We will check your vital signs one last time before removing your IV. You will be free to go with no restrictions to your daily activities or diet. You will be encouraged to drink plenty of water to flush the contrast through and caffeine to help with any nitroglycerin-induced headaches. A common question we are asked when patients are preparing for their cardiac CT appointment is, will I need a driver? Many patients are able to drive themselves to and from their appointments independently. We will not be giving any sedation-type medications. For answers to other questions related to cardiac imaging, please visit our website at conehealth.com/cardiac imaging.